Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Joan Buckley from the Department of Nursing here at Nassau Community College. And today we're going to be speaking about mental health care across the spectrum, okay? Particularly related to our younger family members. So our guest today is Andrew Malekoff. He's the Executive Director and CEO of the North Shore Child and Family Guidance Center in Roslyn Heights, where he has been for 42 years. He's also a published author whose books include the textbook Group Work with Adolescents. He's been editor-in-chief of professional journal Social Work with Groups since 1990. He was recently honored by the National Alliance on Mental Illness for his advocacy addressing access to mental health care. So, Andrew Malekoff, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Well, thank you for inviting me. I'm happy to be here.
So tell us a little bit about yourself. I mean, I just did a little synopsis, but you've been doing this for a very long time. If the beginning, what inspired you in the beginning to just be involved in helping other people's social work and or wherever you started? Just tell us a little bit about how you got to right here today.
Yeah, well, I'm a undergraduate student at Rutgers University, and my major there was in economics. And I really wasn't quite sure where to take that when I graduated. And after doing a number of odd jobs and endeavoring at different possibilities, I had put an application into Volunteers in Service to America, which is VISTA. And that's the domestic equivalent of the Peace Corps. And I ended up being placed in a Mexican-American community in Grand Island, Nebraska. And my work there was to renovate an old church into a community center and then to work with the youth in the community. And so having had no formal experience in human services, it was sort of an intuitive journey at that point in time, and I was able to develop some groups with young people, which is something that I became very interested in, working with groups, the value of people being a part of groups. And so from that experience, I was able to get a job following my time in Vista in a community mental health agency. And the person that hired me was a social worker and a group worker. And so through that relationship and the work that I did there, it moved me to go on to graduate school, which I never thought I would do. So I came out back east and attended the Adelphi University School of Social Work. And my second year internship was with North Shore Child and Family Guidance Center in 1977. And so I've been there ever since.
Now, you're almost crossing like a whole different view of mental health. If we're going back to the 60s and 70s, mental health has a stigma, and we all know that. But even across the decades, what was it like? What's the difference between what you did then for adolescents and what you see now with adolescents? Are children any different? Are adolescents any different? Is your work specifically any different now than it was in the 70s when you started working with this guidance center?
Well, when I was first involved with the work, I think that because what I was doing was mostly in outpatient settings or involved in outreach into the community, we were working with a population of kids that had issues that are somewhat similar to what we're seeing today, kids that were depressed and anxious, kids that were involved with drugs and alcohol, But I think the difference is in these kinds of settings that we're seeing far more complex situations than we were years ago. And I think years ago, the people that were experiencing much more intense difficulties with mental health problems had more resources available for higher levels of care, whether it was in hospitals or day treatment programs. And over the years, the support for those kinds of services started to diminish. And consequently, more and more people with more intensive difficulties, more complex problems, are finding their way to outpatient community mental health agencies.
Now, you mentioned the change. Just do young people come to you, or is it from a referral, for perhaps being picked up for drugs or picked up for some kind of behavior that's illegal? Are they referred to you that way, or are they really finding you? I mean, you're in the same place. So do they come from referral, or do they know you're there?
Well, generally, we see the kids that we work with by referral. They're referred by schools, by pediatricians, by other social service agencies, word of mouth. Families, friends, neighbors will recommend that they come to us. Occasionally, somebody will drop in, and we'll see them that way, but it's usually through a referral.
I know the even insurance coverage has changed drastically in the way that the companies give it. I mean, I thought it was becoming better, but most of this is all insurance coverage covers the cost of it, or is there like a sliding scale for people that have to come more than once?
Yeah, well, that's when you asked about what's changed over the decade.
Yeah.
That's an area where there has been major change, and to the detriment of people that need this kind of care. Access way back when was easier for people, and the agencies that they would go to would either accept payment on a sliding scale, or if they had insurance that covered mental health and substance use disorders, then that would help to subsidize the cost of the care that they were getting. And what's happened over a period of time is more and more there are insurance companies, particularly commercial insurance companies, that do not have enough providers to cover the care. And the reason they don't have enough providers is because of the substandard rates of reimbursement.
Oh, my God. While you're pausing, you're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. My name is Joan Buckley from the nursing department here at Nassau, and we are talking about mental illness, adolescents, whatever you're thinking. We're talking about it with Andrew Malekoff, who is the CEO and director of the North Shore Child and Family Guidance Center in Roslyn Heights. So with that said, okay, that was and you know, you being that you started with economics in your education, I'm sure this hits home for you that these people need you, and yet it's so difficult sometimes to maneuver a normal health system, especially the mental health. What age groups do you see at the North Shore Guidance and Health?
We work with children from birth to 24 and their families.
24 is great. I saw that in your on the website. That seems old.
Well, the reality is that most of who we see is up to about 18, but with more and more young adults staying at home, that if there are issues where someone is at home, then we would be available to work with them. Typically, though, if we get a call that's related to someone of that age, we might also advise them of an adult-oriented center that might be in their area, because then there would be a greater likelihood, if they were to participate in group services, for example, that there would be others that were around the same age as they were.
What does the school report when they send a student to you, or a report? Or I'm sure the student, if the student's insured, it has to have a parent involvement. How much involvement do the parents have when the students are, or the young people are admitted to your programs?
Yeah, well, we won't work with anyone without the involvement of parents. Now, if someone is more than 16 years old, they can say that I don't want my mother or father or both to be involved. They have the right to do that, in which case we wouldn't turn them away. We would, work with them and try to facilitate that involvement. But as a matter of course, we will only work with them with the parents' involvement. So it's really less likely the case that the teenager will say, I don't want my parent involved, and it's more likely the case that the parent thinks that maybe they're going to just drop their child off, sort of like in a service station when you get your car repaired, and then come back and pick them up when it's all fixed. So we don't work that way. We believe very strongly in the family system as having an integral role in the issues that a child is experiencing, and also in the solutions that can be found.
Wow. It's a really incredible thing that you do, because how much, and we don't talk about this, we don't want to think that children get depressed and stuff, but we have facilities, inpatient facilities for children and adolescents. So how does this depression and anxiety and all of these things, how are they filtering into your facility? Are they like a lot of them, or is it more behavior issues? Like what do you see most?
Yeah, the majority of issues that we address that kids come in with are depression and anxiety. That's been pretty consistent over the years. There are behavioral issues. There are kids that are on the autism spectrum, the higher end that we see. So yes, we do see anxiety and depression, and when the referral is made, usually there's some kind of behavior that is observed, which is quite often something which requires an urgent response. We see a lot of emergencies. We have a rapid response team. We see them within 24 to 48 hours. There is a lot of suicidality, school refusal, kids that are cutting themselves. Those are some of the things that we see, and some things that are very disturbing.
Who's on your team? Nobody works alone in the world, right? No. Especially in healthcare and mental health care. So who's on your team?
Yeah, we have a team of clinical social workers, psychiatrists, psychologists, licensed mental health counselors, family advocates, vocational counselors, and also we do have nurses that are a part of our team as well.
Well, that's very important. Nurses are very important. We were just talking about there's no disconnect between a nurse and a social worker in acute care, and it's really nice to see that in outpatient care it's the same. You talked about some stuff. Now, when students don't, or I keep saying students, I guess it's my faculty role here, but when patients come, or do you call them patients, or do you call them, what do you call them?
Well, there's been an evolution over the years. There has. It was patients and clients. And consumers, and so typically we refer to the people that we work with as clients or consumers, but clients tend to be more of the term.
Okay, so clients. You're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. My name is Joan Buckley from the nursing department here at Nassau, and we are talking about mental illness, adolescents, whatever you're thinking. We're talking about it with Andrew Malekoff, who is the CEO and director of the North Shore Child and Family Guidance Center in Roslyn Heights. Please tell me a little bit, in the adult population, not everybody has insurance, and in that respect, I kind of look at the adolescents and the child mental health piece as a little bit better off, because most parents have some sort of insurance that can help defer the cost. Can you just elaborate a little bit more about the insurance and the issues that you see in your facility?
Yeah, this is a national issue. And let me preface it by saying to you that we turn no one away for inability to pay. So we accept everyone that comes through our door, everyone that calls us, regardless of the insurance they have, the rates that they pay, or if they need to pay out of pocket. Now, in order to do that, when you asked me before about the team, the other part of the team that I didn't mention is our board of directors.
Wow.
And our board of directors is critical in terms of ensuring that we're on mission. Our mission is to restore and strengthen the emotional well-being of children and families, and also to make sure that we have the funding so that we can continue not to turn anyone away for inability to pay. Now, in the system at large, there are many providers and there are many community-based organizations that do not have that policy, and they don't because of the financial aspect. And the financial aspect is impacted by the fact that Medicaid pays the highest rates of reimbursement for mental health and substance use disorder care. Commercial insurance pays much lower rates, and as a consequence of that, there are many providers who may be listed on the roster of an insurance company that offers mental health and substance use care, but are not willing to provide that service, so that when someone calls asking for help for their child and they say, I'd like to set up an appointment, they may say, I no longer accept that insurance. So much so that there are probably nationally hundreds of thousands of people that find it difficult to access that care. In 2008, there was a federal law passed called the Mental Health Parity and Addiction Equity Act, which require that health insurers that provide coverage for mental health and substance use disorders treat their coverage on par with the coverage that they provide for medical and surgical care, which also means that they must have an adequate network of providers for people who need this care for their beneficiaries within a certain geographic area. The reality is that they do not comply with the law, and the government does not properly enforce the law. So I often, use the phrase access delayed is access denied. With mental health and substance use issues, there is stigma. People know about stigma. It's sort of like, well, why do you have that problem? Your parents must not have done a good job, or you have a character flaw of some kind. It's an issue. It's a brain problem, and so you can't see it the way you see a broken arm, or you don't experience the way you do cancer or diabetes, for example. So people are often, feeling a sense of shame because of the stigma that's involved. And so what it takes for them, a parent, to make that first phone call to ask for help sometimes takes days, weeks, months, even years. So when you make that first phone call and that provider who is on the list of your insurance company says, I don't accept that insurance, it's very demoralizing, and it could cause, and does, many parents to just back off at that point and retreat and not seek the care that's needed.
Well, you really hit on a point that sometimes it takes a long time for a parent. I'm sure, being a parent myself and raising some teenagers, I know that I thought I could fix everything. But sometimes you can't, and you need to get the professional on board. From the client's perspective, and if we're talking adolescents, because that is like something people don't think that, we hear it. We hear it with bullying. We hear it with the social media stressors for the students, clients. But we don't like to think about it. I don't think that we could possibly have young people with all that they have being depressed or being anxious over anything. what is it takes to turn the client into a participating member of your team? Because they're always the center, right? That's the reason you all work so hard. What does it take sometimes to get a student or a client, I can't do it, to trust you enough to really start having a therapeutic relationship with your team members?
Yeah, and I mean, student is fine because most of them are students.
Thank you.
And we actually do have 3 school-based mental health programs, so we see kids on site in the schools. But one of the fundamentals of providing mental health care, whether you call it counseling or therapy, whether it's with an individual, a family, or in a group, is the establishment of trust, and the term that we use is engagement. And so to engage somebody, they have to feel that they're in a safe place, that they can trust you, that you know what you're doing, that you'll show them respect, confer upon them the dignity that they're entitled to. And that comes in very small steps with some kids. With other kids, they warm up a little bit more quickly, but it's something that the people that do the work need to pay very close attention to at the beginning and throughout, and that they must also, be self-aware of what the people they're working with might trigger in them, because some of the kids that we see trigger their teachers or personnel and administrative personnel in school or people in the community. It's just the nature of the issues they're dealing with that it can set people off to become angry or dismissive or disgusted with them in some way. So when we work with kids, we're no different than anyone else. Those feelings will be evoked and triggered in us, but part of the training of someone that does this work is to be self-aware and to not allow those feelings to create, some kind of impulsive response in you that will then alienate that young person, or will make them feel like you don't respect them or, see them as someone that has dignity.
You said respect. That's a great word, no matter what in life. But in this situation, it's really, really important. You're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. My name is Joan Buckley from the Department of Nursing, and I am speaking with Andrew Malekoff, the Executive Director and CEO of North Shore Child and Family Guidance Center in Roslyn Heights. That's a mouthful. What are some of the success stories? Like, do you have students? Do they graduate? Is the student able to say, I've had enough? Or is it, again, you try to grab the parents into the conversation, I'm sure, all along. Is it a decision that's made by your team, or is it made by the person that's at the center of the team?
Well, it should always be mutually determined. That when we begin with someone, we set goals and objectives. Those are discussed together with the individual, with the family. We try to work towards resolving the issues within a shorter rather than a longer period of time. I think the key is, when we talk about depression and anxiety and behavioral issues or whatever else somebody might come to us with, it's not the fact that they have this diagnosis alone. It's really the question of how that diagnosis, how that issue that they're struggling with is interfering with their everyday functioning at school, at home, with friends in the community. And so when we look at goals and objectives, what we have in mind is how to improve their functioning so that they're able to have a life. And so I think that for most that we see, that we're able to achieve the goals that we set out. However, what's very important is for them to have the message, and the message comes within the context of us being a community-based agency, almost like extended family, is that you can leave and maybe all of your problems are not resolved, maybe there's still some struggles you'll have, and you can come back again. And that happens, that kids will come when they're younger children where maybe they're having one kind of a difficulty, maybe paying attention in school and concentrating. Maybe they come back as a teenager. Maybe there are some behavioral issues at that point, or somebody could, get into a scrape that could get them thrown out of school or in trouble with the law, or maybe they're just feeling, really down in the dumps and beyond just everyday sadness. And then maybe as they approach later adolescence, they're getting anxious about going off to college, and that's something that they need help with. So not everybody does that, but I think the term I like to use is in again, out again therapy, which means that you can always come back. You can come home again, in a sense. And I think that gives families, a great sense of satisfaction that they know there's a place that they can return to that does feel a bit like family.
Wow. You've spent a good portion of your life here with this center, but you write. So when did you say, well, I've experienced all this, and you experienced it working with this population and with the people. So when did you start saying that there's a need for you to write? Because you do write, and you wrote a book. And how has that been a part of your life now? Because that's where you're at now, writing and sharing with other people. The experiences that you've more or less had have driven that. So tell us a little bit about that.
Well, I came to the belief early on that because there were a lot of very moving, enlightening experiences in this work, experiences that could be used to, teach others or inspire them, I came to the understanding that not to share an experience or not to preserve an experience is to betray it. And so one way to share an experience is by talking about it as we are now, or speaking in front of a group. Writing is a way of preserving it, making it indelible so it lasts, forever. And so I just found that as I came to new understandings from working with different children and teenagers and families, that there were certain things that I thought that people that were coming into the field could benefit from based on these experiences. And so ideas come to me and from these experiences, and I try to write about them through whether they're academic type of journals and books, as you said, but I also write columns for local newspapers so that the public, as well as professionals, can be educated and informed and become active and can use their voice where there might otherwise be people who are voiceless because of the stigma and shame that we talked about earlier, people who are discriminated against because of the mental health issues that they have, to understand that this is a civil rights issue and that they can make a difference.
Wow, that's the perfect way to end this interview. And this is, I want to thank, first of all, Andrew Malekoff for coming today and being with us and sharing so much really great passion for a population that we don't want to think that they have a problem. But this is Joan Buckley from the Department of Nursing here at Nassau Community College, and we want to thank all of you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.